Chatting with veterinarian Dr. Paul Crooks this morning, who's across there in Tobago, as Lisa said. Good morning.
Good morning.
Thank you for joining us this morning. So, a lot of people have so much love for their pets, and, they get very worried when it comes to anything dealing with their pet. They treat their pets sometimes better than they treat people. So in this uncertain time of COVID-19, what are the main issues surrounding, the spread of any virus, but more so COVID-19 to pets?
Well, precautions are the same across the board. Hygiene practices are most important. Social distancing for human animals is extremely important. But the American Vet Medical Association put out some recommendations, and those recommendations take into account most current information on the COVID-19 outbreak and its relationship to animals.
Right.
So as far as possible, if somebody in a household, let's say, were to test positive for COVID-19, the recommendation would be for that person to avoid contact with all animals.
Okay.
Whatever the animal may be, whether it be human, pet, or otherwise. Because even though it is right now, there's no evidence to suggest that the disease can pass to dogs or affect any other domestic animal. And while there is no evidence to suggest that domestic animals have been able to transmit the disease to humans, we'd rather not risk it. So
Right.
if anybody is COVID-19 positive, if there is the off chance or very rare possibility that a dog could pick it up, or a dog could even just carry the disease mechanically from one person to another, we would want to eliminate that risk. So the recommendation there, and I think that would be the primary concern for most animal lovers, the recommendation would be that someone else care for your pets if you are sick. Someone else in the household care for the pet, or perhaps the animal is left at a boarding facility or hospitalization facility.
I was about to ask. Say, for instance, if you're someone, you live in a household alone, you have a pet, and you don't really have someone that is able to or is willing to take care of your pet for you, what could someone like that do?
Yeah, so our recommendation would always be call your vets. And this time, this is an unprecedented situation for everyone, certainly, and we're all adjusting and learning. Guidelines are being updated all the time. If there is ever evidence of community spread, and let's really hope that doesn't happen in Trinidad and Tobago, but if there ever is evidence of community spread here, our recommendation would be definitely to support what the Ministry of Health says. Don't leave unless it's essential. So all non-essential veterinary visits should be cut out. Vaccinations, deworming, spays, neuters, dental cleaning, that sort of thing should be postponed until such time as we know that we have established herd immunity and there's a very low risk of human-to-human transmission at that time. So right now we would recommend calling your vet, determining what is the best course of action, what the vet has implemented at his office. Right now we are telling clients here in Tobago to wait in their cars until we meet them at their cars and invite them up.
Right.
And even then, we are inviting up one client at a time with an animal. So if you come with, wife and kids, yeah, everyone is home now. So if the whole family comes along for the trip, it is only one client we're inviting up, and there are hand wash stations before and after visits, hand sanitizer everywhere just to remind people of good hygiene. They're welcome to utilize them. And eventually, hopefully, not anytime soon, but eventually we may have to use masks and so on. But we are observing those sorts of protocols.
I want to ask you a hypothetical question and go even further to say worst case scenario. If in the future they in fact discover that it can be transferred from animal to animal, domestic that is, or from human to human, I'd even go further to say, some people do have exotic animals as pets. If it has been discovered that it can transfer that way, could you give us an idea of how drastic the implications could be in a case like that, especially for pet owners?
Okay, so there are a number of different factors to consider. Even now, with the isolation that we're going through, there's always this sense of balance and trying to ensure that people maintain a sense of socialism or socialization, I should say, the ability to go out and exercise, meet others, even if it's via the internet. Those are the kinds of things that are important to quality of life outside of just physical health. And so, trying to determine what would be the best course of action, I think it would be at this point, have we established herd immunity? Are people vaccinated? Because we are potentially looking at a year in the future if the virus were to mutate or if there were a similar virus. Are people vaccinated? Are they immune? If they're not immune, then really drastic action could be taken. Depending on the public health risk, it could be recommended that animals be even euthanized. And then you would have backlash from animal welfare communities, from people who recognize that their pets are part of their families. Should we then go ahead and euthanize our brothers or sisters because they pose this risk to us?
Right.
Would you do that if it was a human who had the disease? So those are the factors that would have to be considered. And ultimately, tough decisions would have to be made.
Definitely.
And when those decisions are made, then we just have to comply.
And in the case of emergency situations, what are some of the, well, veterinary-focused numbers that people can call or to just reach out in the event they have a sick animal, not necessarily COVID, of course, but what are some of the numbers or emergency contacts persons can reach out to in Tobago?
The office number for the Tobago Animal Hospital is 239-7837. Social media, we are available on WhatsApp at 688-8281. And at any time, persons can find us on Facebook, message. Any questions, people are welcome to ask, because it is an interesting time for us to be alive and to exist through an event such as this. None of us ever wanted to experience, but here we are. So we're all adjusting, and people are welcome to ask questions, even if they think their questions are stupid. They're welcome to ask at this time.
Right. All right. And with that, I want to thank you so much for the information and update. And of course, we will touch base with you in the future. But for now, we're going to take a short break, guys, and come back with much more. Stay with us.